And hi, everyone. How are you doing today? I am so excited to be back on Dr. Sumner's Summit to Wellness. We are getting started yet again, just waiting for a couple of people to join in, but so excited to have you guys here. Thanks so much for joining. Simone, good to see ya. Thanks so much for joining. Holt, Virtual Assistant, it's good to see you. So yeah, we're here today live again. I'm wearing red for American Heart Month because our topic for today is all about heart health. And I'm really excited, really pumped to share this information with you guys. It's gotten a bit of traction, honestly. Hi there. Since I posted about the topic for tonight's live, for today's live, because it's information that, hi Nicole, thanks so much for joining, Dr. Nicole. It's information that I've learned that even myself, before I really started digging a little deeper, I didn't know. A lot of people in general don't know, and even a good amount of doctors aren't aware of some of the information that I'm going to be sharing with you guys today. So I'm really excited. So if you or your family member, someone you love, is at risk of heart disease, if they have high blood pressure, high cholesterol, if they've had a heart attack or stroke before, or in their family, then you need to tag them seriously today, because this is information that I really don't think you want to miss out on, okay? But let's get started, guys. I'm Dr. Sumner. For those of you who don't know me, I'm your board-certified family medicine physician, and I'm also a wellness strategist, and I am dedicated to empowering you and your communities to become well. That's whole, energized, and loving life. And I do this through speaking engagements, telemedicine services, and online coaching services. I also need to just briefly remind you of a disclaimer that as much as I truly enjoy helping to inform you about topics related to your health and wellness, this is not medical advice. This is for informational purposes only. So if you have any specific questions related to your individual diagnosis or treatment plan, then please discuss them with your doctor. And if I'm not your doctor and you'd like me to be, then please visit Dr. F as in Felicia, Sumner.com, or message me and I'd be happy to get you set up for an appointment. I currently see patients in the states of Georgia and Pennsylvania online, and it would be my pleasure to see you. Okay, so now that the housekeeping is out of the way, so it's February, and that means it's not only Black History Month, but it's American Heart Month. And like I said, at the same time, it's also Black History Month. And ironically, with heart disease being the number one killer in the United States, the risk is even higher for Black Americans. So it seems to be that no matter what your background is, especially here in the US of A, heart disease is really a serious matter. And we hear far too frequently about even celebrities leaving us in an untimely death from cardiac arrest, which I'm sure that term you're familiar with. Cardiac arrest, it occurs when the heart stops beating. And the causes, it can include electrical disturbances in your heart rhythm, heart attacks, and other heart-related conditions. But the most tragic part of the story for a lot of people who die from heart disease is that their friends and their family, they'll often say they did not even know that they had any underlying health problems. And heart attacks, they really often do come by surprise, and it is devastating when someone that you know and love is affected by such a potentially fatal illness. Like I said, heart disease is the number one killer in the United States, according to the CDC, and about 1 in 10 heart disease deaths occur in people under the age of 55. And about every 34 seconds, someone in the US has a myocardial infarction, also known as a heart attack. Every 34 seconds. So how does it happen? Why do some people find themselves battling or surprised by heart disease and others don't? Well, there's a number of factors that can increase your risk of heart disease. And some of these fairly well-known risk factors, they include obesity, high cholesterol, high blood pressure, smoking, physical inactivity, not moving around a bunch, excessive alcohol use, you've got a family history of heart disease, but that's not the entire picture, because studies show that 75% of people who have had heart attacks had what we label to be normal cholesterol levels. So we'll definitely talk about cholesterol today, but I'd also like to discuss a more thorough approach with you guys of numbers that you need to know in order to effectively assess and lower your risk of heart disease. Okay? So thanks again for all of you who have joined. Hi, Bessie. Hi, Virginia. Dr. Virginia, thanks so much for joining. If you or a loved one you know is at risk of heart disease, or you are currently battling heart disease, this is information that I need you to share. Please, please, please tag those that you care about, because this is valuable information that I don't think should be in the weeds and no one knows about it. Okay, so some tests that you need to ask about when you're at your next doctor's appointment. That's what we're going to go over. And some of these may not be familiar even to your doctor, but many of them are. And remember though, your doctor is your partner. And we can't know everything, but we certainly wish we could. So research and modern medicine, it changes every day. And the idea of inflammation affecting your heart health is still being explored, but it's very well proven at this point. So please tune in, stick with me, and we're going to talk about the tests that you need to discuss if you or your family has a history of heart disease, heart attacks, strokes, or high blood pressure. And I would highly recommend that you grab a pen and paper if you can, so you can keep record of these very important numbers that I'm going to go over for you and for your loved ones. All right, so let's get started. Hi, Jill. Thanks so much for joining. So number one, the first test, hi, Sharon, thanks for joining, that we're probably all familiar with is your cholesterol level. And statins, which are the medications that are used to lower cholesterol levels, are the second most commonly prescribed medication in the world. But here's the thing, when you have a heart attack or a cholesterol problem, do you have a statin deficiency? Or is there something more so underlying in your lifestyle that needs to be addressed? And unfortunately, statins are not free of side effects. They can cause muscle damage, GI upset, cognitive impairment, and sexual dysfunction, amongst many other things. And statins are not the only thing that can reduce your risk of heart disease. For example, if you consume dark chocolate, more than 70% cocoa or cacao, it can decrease your risk of heart disease by 45 to 77%. A handful of nuts a day, that can reduce your risk by 20 to 30%. And drinking a liter of raw olive oil a week will also reduce your risk about 30%, which is actually as much as a statin will do. So I'd like to emphasize that I'm not saying if you take a statin, you should stop it right away, or even that it's not the right treatment for some people. But what I'm saying is, if you want to be invested in your or your loved one's health, then you may need to dig deeper. You may need to educate yourself further on what to ask your doctor and what additional tests you may need before taking a statin for treatment. Tiki Tinax asks, liter of olive oil. Yes, that's what I said. That's what the studies show. Usually poured on, like, use it as a dressing for your salads and things of that nature. Only you live with yourself every single day, okay? And you need to know your own body. You need to know your own risk factors, all of your numbers, and you need to make an educated decision about what you put into your body with the help of your doctor. And truly, studies show that only people who have a high risk for heart disease, who have a heart attack or people with genetic cholesterol disorders should take a statin. So let's dig into these cholesterol levels a bit more, guys. All right, let me just double check. No more questions for now. So when there is, but certainly feel free, ask questions along the way. I'd like this, of course, as usual, to be as interactive of a conversation as possible. So when there is too much cholesterol in your blood, it builds up in the walls of your arteries, and that's what we call atherosclerosis. If someone can put that in the comments for me, I'd appreciate it. Atherosclerosis, that means the hardening of your arteries, and that's a form of heart disease. And the arteries, they become narrowed, and the blood flow to your heart muscle, that's slowed down, or it's even blocked. And the blood, it carries oxygen to the heart. And if enough blood and oxygen can't reach your heart, you may suffer chest pain, what we call angina or angina. And if the blood supply to a portion of your heart is completely cut off by a blockage, the result is a heart attack. All right, so atherosclerosis, thank you for typing that, Dr. Virginia. So there are two forms of cholesterol that we're most familiar with. There's low density lipoprotein, which is also known as LDL, or the bad cholesterol, and high density lipoprotein, also known as HDL, or the good cholesterol. And these are actually the forms in which the cholesterol travels in the blood. So it's technically not even cholesterol, but it's like the transporter for cholesterol. But here's the deal though, when we talk about cholesterol, even LDL cholesterol, high cholesterol in and of itself is not the enemy. You actually need some cholesterol to do some really important things. For example, some of your sex hormones are formed from cholesterol. It's not really a problem until it's damaged by free radicals, where it oxidizes or it goes rancid. And there are forms of cholesterol that are much less concerning than other forms. And this goes for LDL as well as the HDL. And that's why it's essential for your doctor to order a test that shows the full profile of your cholesterol. And the best tests are the NMR profile by LabCorp. If someone can put that in the comments for me, NMR profile, that's with LabCorp, or the cardio IQ test. The cardio IQ test by Quest Diagnostics Lab. Okay, I'm mentioning those because those are the most common that many of us, those are most common labs that most of us doctors will order from. Hi Martha, thanks for joining. Hi Olasambu, thanks for joining. So when you get this test done, the NMR profile or the cardio IQ test, these are the numbers that you and your doctor will see. First, a total cholesterol, which is the total amount of cholesterol, but it's not specific to the type of cholesterol. So honestly, this number, it doesn't tell us too much because it lumps together the HDL, the good cholesterol, and the LDL, the bad cholesterol, and it doesn't differentiate between the particle characteristics. So yeah, there's total cholesterol. But then there's HDL, which is the good cholesterol. HDL actually works to clear cholesterol from the blood and back to the liver for processing. It's protective against heart disease, and it can be raised with exercise. In women, this number should be at least 50, and ideally 60 or higher. And in men, this HDL number should be 40, and ideally 50 or higher. And unfortunately, HDL sometimes can, believe it or not, behave dysfunctionally. And even when it is high, it may not be the entire story. So sometimes a high HDL, it's actually not a good thing. And I'll discuss that in a little bit, okay? And LDL, that's the other type of cholesterol or cholesterol transporter, is the main source of artery clotting plaque. And this is why it's called the bad cholesterol. Let me see here. Martha said, what are some foods that bring bad cholesterol down? We'll talk about that in a second, Martha. Stay tuned, okay? So currently, Most of the mainstream medicine says that the LDL number should be less than 130 for most people and less than 100 for some people with more risk factors. LDL is the bad cholesterol, but as I've said before, we need to dig deeper. The LDL particle number, is a much better measure for heart disease than just the LDL number itself. We can also look at whether the LDL present is oxidized or rancid, and whether it's small and dense, which is more problematic than if it's big and fluffy, which is less problematic. A normal LDL is less than 100, and ideally it should be less than 90. But then there's also an important measurement of the number of LDL particles that are in your blood, also known as LDLP or LDL particle number. If someone can put that down, LDLP or LDL particle number. Hi, Sarah. Thanks for joining. Dr. Nicole, thanks for joining. She asked, are these tests covered by insurance? And yes, most of the time, if you have any risk factor for heart disease, if your doctor is able to order a regular standard lipid panel on you, those same diagnostic codes that they use to order a lipid panel usually will cover you getting an NMR or a cardio IQ test. Thanks for that question, Dr. Nicole. So as I said, the measurement of the number of particles that are in your blood, also known as the LDLP or LDL particle number, we can compare this to the regular LDL or the LDLC. That's the one that we're familiar with. And that's actually the weight of the LDL in your blood as opposed to the actual number. And this measurement of particle number is more important when we're considering your risk factor for heart disease than the LDL measurement that's found on a standard lipid panel. So the optimal level for LDLP or LDL particle number is less than 1,000, okay? Sarah said, when will this be up? I want to send to a friend. On Facebook, it will be available to view permanently and on YouTube. I'll have the link for you guys later. And of these LDL particles, you have big ones and small ones. And the small dense LDL particle, also known as SD, small dense LDL, they're like little beads that, especially when they're oxidized or rancid, they can damage, major damage to your arteries. They can squeeze into the arteries. And this number, also known as SD-LDL, should be less than 400. These small LDL particles, they're much more concerning than the large, fluffy LDL particles, because the large ones, they can bounce off your arteries like a beach ball and they won't cause the same kind of damage as the small dense LDL at all, okay? Nicole said LDLP or LDL particle number. Yes, thank you for typing that in, guys. Thanks for joining, Denise. So next, there's oxidized LDL. And this is the amount of LDL that is damaged. Oxidized or damaged LDL, that increases the risk for heart disease compared to non-oxidized LDL because it forms plaques that can narrow our vessels and increase our risk for heart attack and stroke. A normal amount of oxidized LDL is less than 70, but should ideally be less than 60. So the take home, guys, from that so far is it's not just about one cholesterol number. It's about the type and the behavior of these cholesterol particles, because studies also show that low cholesterol can be just, if not more damaging than high cholesterol. Again, depending on your type. So we're all so obsessed with high cholesterol, but studies show that low cholesterol can lead to increased suicide attempts, depression, sexual dysfunction, and even cognitive impairment due to not having enough fat fuel for your brain. A study actually showed that women with low cholesterol have 16 times greater risk of committing suicide than women with normal cholesterol. And that's because cholesterol is the building block for a lot of our hormones and even some vitamins, including vitamin D, which is closely linked to our mood. It's essential to coating our nerves so we can send appropriate messages throughout our brain and our body. So low cholesterol is not the only key here. So now, let's talk amazing, great info. Thanks, Tiki Tenax. Thank you for sharing, for commenting. So now let's talk about triglycerides. Triglycerides are fatty acids that help with fat storage, and elevated triglycerides are actually associated with carbohydrate intolerance. So having high levels of triglycerides might mean that you need to cut out processed carbs from your diet. Triglycerides should ideally be under 100 or even under 70. Most labs say under 150 is fine, but I don't really think that that's true. Triglycerides are often high because of a high processed carb diet. That's things like starches, sugar, flour, all of that. The most impacting part about this test is your ratio of triglycerides to HDL. This is a ratio that is actually more predictive of heart disease than almost any other ratio on your cholesterol panel. And unfortunately, most of us doctors don't pay that much attention to it or even order it. And this ratio should be under 2. Some experts even say under 1. So that means, like, let's say your HDL should be 70 and your triglyceride should be 70. That would be a ratio of 1, which is ideal. If your triglycerides are 140 and your HDL is 70, maybe it's okay because that ratio is 2, but you still want to lower triglycerides. If it's over 2, you almost certainly have what we call carbohydrate intolerance. And this ratio is another way to tell if you've developed insulin resistance, in addition to getting like fasting insulin levels. So contrary to popular belief, fat doesn't cause the fat in your blood to go up. It's actually the sugar and the starch that raise your cholesterol most of the time. Processed carbs, sugar, even just starchy vegetables can be a problem if you eat a ton of potatoes. And that tells you that you have carbohydrate intolerance. And that's what's driving these abnormal blood tests. Very informative. Got my book today. Thanks, Pam. Thank you for that comment. So far we've talked about the cholesterol panel and the things most of us, including us doctors, don't always pay attention to, but should if we're concerned about any risk of heart disease. We've talked about checking this with the right test, a NMR profile from LabCorp, or a cardio IQ from Quest, not the standard outdated common lipid panel. If you're insured, like I mentioned before to answer Dr. Nicole's question again, this is typically covered by your insurance if you have any risk of heart disease, which includes high blood pressure, diabetes, high cholesterol, amongst many others. If you're not insured, you can still talk with your doctor about affordable options if you're interested in getting these tests. We talked about total cholesterol, possibly the least helpful number on your cholesterol profile. Then we discussed HDL and LDL cholesterol particles. HDL is usually the good cholesterol and should be more than 50 in men and more than 60 in women. We also talked about LDL, the bad cholesterol, which should ideally be less than 90 to 100. But more importantly, we talked about LDL particle number as opposed to the weight or the regular LDL that we're used to seeing in our lipid panel, which should be less than 1,000. And then we discussed the small dense LDL particle number, which is the small BD cholesterol particles that can cause much more damage than the big fluffy ones. And this number of SD-LDL, small density LDL, should be less than 400. We also discussed oxidized LDL, which is the damaged or rancid LDL that really causes most of the damage and builds up plaques in your blood vessels. And this should be less than 70 and ideally less than 60. And we also discussed, we just discussed triglycerides, which are the particles that help with fat storage, but not actually related to the fat you eat. So that should be less than 150, but ideally less than 70. But more importantly is your triglyceride to your HDL ratio, which should definitely be less than 2, but ideally 1 or less. And if it's more than 2, it means you're eating too many processed carbs and you may already have insulin resistance, which could lead to diabetes. Dr. Nicole said, why aren't doctors ordering these tests if they are better? Great question, Dr. Nicole. Honestly, because we weren't taught to. And science changes every single day, and there are different agendas that are a part of our medical school curriculum, in many cases, sadly influenced by pharmaceutical companies. And as stated before, statins are the #2 prescribed medication in the world. And so the answers aren't easy to find, even for us doctors. And most of us just do not gain that information until we dig a little deeper. I myself did not know any of this until I decided to dig a bit deeper with training in functional medicine. So that is why most doctors are not ordering these tests. But that's why I also want to empower you all and educate you so you can help your doctor be your partner. We know we don't know everything, and we don't mind learning more. So that's why I would love for you to spread the word. And I know I've got a couple of doctors on the live with us now who are very much dedicated to doing the best for their patients, and that's a part of why they're joining me today too, because we just don't know what we don't know until we find out what we don't know. So we went over the cholesterol panel, but here's the kicker. This is only half of the picture. Studies have found that if you have a high level of inflammation in your body, even if you don't have high cholesterol, you're at risk for heart disease. And on the same end, if you have a high level of cholesterol and no inflammation, then there's actually no risk of heart disease. So let's dig deeper to get the entire picture with the importance of testing your inflammation levels. So let's first start with CRP, aka C-reactive protein, if someone can put that in the comments for me. It's a protein made in your liver, and it's an indicator of inflammation. Specifically, HSCRP, or high sensitivity CRP, is the cardiac specific inflammation marker. So if it's elevated, it suggests that you have an increased risk for heart disease. If you have both high cholesterol levels and high inflammation markers like HSCRP, then it's much more concerning than just elevated cholesterol levels by itself. A normal HSCRP level is less than 3, but ideally it should be less than 1. Sarah said, not all doctors are open to outside knowledge or want to work on your health with you. I'm sorry you feel that way, Sarah. You are correct in saying not all, but I will have to speak on behalf of my colleagues. Most of us do want to learn more. We know that We're perpetual students as physicians. So consider bringing this to your doctor, and if they really are closed off with the idea of doing more testing for the sake of your health, then I implore you to consider getting a second opinion. It doesn't offend us in any way if you have to find somebody who's going to partner with you in the way that you need to become whole, energized, and loving life. Okay? So we just talked about HS, high sensitivity CRP levels should be less than 3, but ideally less than 1, and that's a major inflammation marker. Dr. Virginia said, yes, so much new research out there every year. Yes, our eyes are open to what's really going on once we're practicing. Exactly, Dr. Virginia. Another helpful inflammation marker is called homocysteine. Homocysteine, if someone can put that in the comments for me. If these are elevated, it could indicate a risk factor for Alzheimer's disease, cancer, heart disease, and so much more. So your homocysteine levels should be ideally between 6 to 8. Thanks for joining us, Dave. And if it's high, it could actually be because you're low in vitamins B6 or vitamin B12, and it could be improved with one or both of these supplements. So keep that in mind. And two other very helpful markers in assessing your risk of heart disease are ApoB, ApoB, and ApoA1, ApoA1 levels. If someone can also throw that in a type form in the comments for me. ApoB, ApoB, and ApoA1, ApoA1 levels. ApoB is an advanced cardiac marker found on the LDL, the bad cholesterol, and ApoA1 is found on the HDL, the good cholesterol. So looking at the ratio of these two markers is a more accurate risk predictor for heart disease than the ApoA1 and the ApoB alone. And that ratio should ideally be less than 0.8. Again, crazy fun fact, ApoB, the marker found on LDL bad cholesterol, is elevated from eating starch and sugar. So have you noticed a theme yet? Now, another marker for heart disease that's important to know is your fibrinogen level. If someone can put that in the comments for me as well. Fibrinogen level. Fibrinogen is a measure of blood flow and your clotting risk. It basically shows how sticky your blood is. So we want our blood to flow fairly freely so that we don't form clots, because if we do, we're more likely to have a stroke. We want some fibrinogen, otherwise if we banged ourselves against something or accidentally cut ourselves, we could bleed to death. So we want some fibrinogen, but we don't want this level to be too high. So ideally, your fibrinogen level should be less than 300. Fibrinogen levels are usually high from too much inflammation in your body, and that can be lowered by eating more of the healthy fats like omega-3s and fish oils. We talked about some healthy fats in one of our previous videos. Avocados are a fantastic source. Now, there is one marker that can assess your risk for heart disease that has much more to do with genetics than your diet. Sarah says, my friend has a clot. That's why I was asking if you share. Yes, okay. Yes, definitely. Please share this video with anyone you think would benefit. So the one marker that has much more to do with your genetics than your diet, it's called LP little a. LP little a. So LPA. If you have a family history of heart disease and your lipid panel shows elevated LDL, then this is a must order test. It's separate from the NMR profile, the cardio IQ test. But even though you may have elevated LPA levels and it's tied to genetics, there are still natural therapies that can lower LPA and reduce your risk of ever developing heart disease in the first place. For example, one of the therapies that has been found to reduce Lp(a) is niacin, which is a B vitamin. So ideally, your LPA level should be less than 30. So we went over a lot of information today, a lot of blood markers that can tell you so much about your risk of heart disease, your risk of getting your first, or God forbid, second heart attack or stroke. I know this can sound somewhat overwhelming and even confusing, especially when there seems to be some controversial info out there. But the key is there's more to it than just one number. You are a whole person. So we have to look at your whole entire picture. You owe it to yourself to dig deep and know more. Your doctor is your partner. And most of us are more than happy to learn about you and about science and medicine in general. The plant-based MD said, what laboratory runs this test? I'm assuming it's a send-out reference lab. Excuse me. In most cases, yes, unless your office is set up for it, it is a send-out, but it's the cardio IQ test with Quest and the NMR profile with LabCorp. Okay, we'll measure a much more helpful markers with regards to your risk of heart disease. Sarah said, what's a good blood pressure? Mine is usually good blood pressure in most cases is around ideally 110/70 or less. That's the ideal number. Traditional numbers say 120/80. Remember, guys, knowledge is power, and the health of your heart is in your hands. So do you guys have any other questions? I'll hang around for a couple more minutes, but I do hope this information was helpful for you. Was it helpful? If so, please let me know. I'd love a thumbs up, comment, and really if it has been eye-opening for you in any way, if you've learned some new information that may change how you approach things, whether you're a physician, a nurse, a patient, anybody, and this will change your approach in some way, and you think it would benefit someone else, please share this video, tag your friends, tag your loved ones, okay? And if you'd like to test these numbers with me and you're a resident in the states of Pennsylvania or Georgia, or you have other concerns and you'd like to see me online for a consultation, I'd be happy to see you. You can schedule an appointment through Dr. F as in Felicia, Sumner.com, drfsumner.com, or message or call me and I'll get you set up. Any other questions, guys? A lot of folks said it was helpful. I'm fascinating. I'm so glad to hear that this has been helpful information for you guys. Truly, I just want you to be empowered to get well, whole, energized, and loving life, to really enjoy the life that you live, not feel concerned, dragged every single day, waking up, and not feeling the best you that you can be. So again, I'm Dr. Felicia Sumner. I'm your board-certified family medicine physician. I am dedicated to wellness and dedicated to empowering you and your communities to become well, whole, energized, and loving life. And guys, stay tuned because I've been having so much fun doing these lives that I think I'd like to take things to the next level. I get a lot of questions through Facebook Messenger, text, Instagram messages, calls, etc., related to many of the topics that I've shared with you guys thus far. So aside from my book, which I hope you can pick up about self-care, which is vital to maintaining true wellness, and that came out of really me trying to address a need. I've also been working on something very special that I think many of you would benefit from. So we're almost ready with it. So join me next week, I think Monday, but I'll put out an announcement when I reveal an awesome freebie for you and much more info to come. So if you'd like to join my email list to stay abreast of new things to come. I've also got a nice recipe guide to give you for free when you join. Then feel free to message me with your email address or comment below. But until next time, guys, be well, whole, energized, and loving life. Take care, guys. Have a great, great rest of your day.